Alright, let's deal with the facts and figures in relation to blindness today. Please note that there is nothing clinical in today's lecture. There are no concepts that I'll be teaching, but I do understand that numbers are important from an MCQ point of view. I personally do not enjoy teaching numbers because there's nothing to teach, but I've just tried to compile all the facts and figures that I can find across all the books. So let's get right into it. So first and foremost, how do you define blindness? So there is one standard definition that we utilize across ophthalmology, and that is the World Health Organization definition that says that the visual acuity has to be less than 3 by 60 or equivalent. So when I say 3 by 60, it basically means that on the distant chart, what a normal individual can see from 60 meters away, this blind patient has to come even closer than 3 meters. So that's how close he has to come to see the same object which a person from 60 meters, a normal person from 60 meters can see. So why the statement or equivalent? Because certain countries do not use meters. This 3 by 60 is in the meter form. Certain countries use a feet or a foot measure. So in that case, the definition remains the same, but the numbers will change depending on the units that we use. Or the other thing that can define blindness is a visual field loss to less than 10 degrees from central fixation. So what do I mean? The central fixation is carried out by the macula in the retina. So the patient has vision only 10 degrees on any side of the macula. So, the retinal field, the patient's perimetric field is described in degrees. So only less than 10 degrees of vision is available for the patient, which means only a central vision of less than 10 degrees on any side of the macula is available. This has to be in the better eye with best possible corrected visual acuity. So BCVA stands for best corrected visual acuity, which basically means whatever I try spectacles, I try low vision aids, whatever I do, the patient's vision does not improve beyond that. So these are the three or rather four parts for the definition of blindness. So how does the National Program for Control of Blindness define blindness? Since March 2017, the definition has been the same, and there are, of course, political reasons for the change in definition as much as there was medical. Previously, it was defined as less than 6 by 60. Compared to the WHO definition, it is 3 by 60, and here it is 20 degrees, whereas in WHO it was 10 degrees. So before, when we were using the old definition, the number of blind individuals in India, which means the number of individuals with vision less than 3 by 60, was 12 million. Immediately on changing the definition, the number obviously dropped to 8 million because now more people with worse vision are included. People who have vision between 6 by 60 and 3 by 60 are also included, are excluded, from the definition. So obviously there is a drop in the number of individuals, and naturally the prevalence of the disease also decreased. So the current prevalence is said to be 1.1% and the target is 0.3% by the year 2020. So now we all know how 2020 is going for everyone. So nobody is going to check this number. Maybe next year the numbers will be a little more, cheerful. So let's talk about the categories of visual impairment that we have. So when I say a patient is visually impaired, it means his vision is less than 6 by 18 on Snellen's distant chart. So why do I take distant chart? Why don't I take near chart? Because many of these visual impairments are in elderly patients, and if I include near chart as well, then presbyopia becomes a confounding factor. Patients who are elderly will naturally have presbyopia and their vision will be worse than a younger individual, whereas the distant vision is not as much affected by the presbyopic condition. So category 0, which means there is normal vision, which is vision between 6 by 6 to 6 by 18. Category 1 means now there is an onset of visual impairment. So the vision is from 6 by 18 to 6 by 60. This is also called low vision. And category 2 becomes 6 by 60 to 3 by 60. So 3 by 60 is very often also called finger counting at 3 meters. This finger counting at 3 meters was introduced so that people who do not have access to the Snellen's chart can also evaluate. It pretty much means the same, that an object is visible at 3 meters. So 3 by 60 is the same as finger counting at 3 meters. This is also called economic blindness in certain countries, and severe visual impairment is also a term used for category 2. Let's come to category 3, a little more worse than this, 3 by 60 to 1 by 60, which means finger counting 3 meter to finger counting 1 meter, or here the visual field defects start coming into the definition. So visual fields 5 to 10 degrees only. So this is also called social blindness because now the patient cannot socially interact with individuals. 1 meter to 3 meters is the vision that is available. Beyond that, the patient cannot interact socially. That is why it has been called social blindness. Category 4 is vision 1/60 to only perception of light present or visual field less than 5 degrees from this fixation from the macula. This is also called legal blindness because it has legal implications such as job opportunities, employment options, so on and so forth. Category 5 is absolutely no light present in either eye, no perception of light present in either eye, and this is also called total blindness. There is a category 9 also that has been introduced in 1992 definition. So this is an undetermined or an unspecified blindness. Many a times you will notice an examiner asking a question, what is avoidable blindness? So avoidable blindness constitutes preventable and curable blindness. Preventable means basically the causative factor can be easily managed. For example, a corneal blindness, which is due to a vitamin A deficiency, or due to a trachoma, which is due to chlamydia trachomatis. I believe serotypes A, B, BA, and C, I think, if I'm not wrong. And curable blindness basically means vision can be restored by timely intervention. Say, for example, a cataract can be operated and the blindness can be cured. So what causes blindness? So these are numbers, across various surveys in India. Please note that all the numbers in this presentation are absolutely, valid. These are taken from proper studies, proper standard textbooks. So please do not worry about the authenticity. These have been verified by me. If you wish to have a source of all these facts and figures, I'd be very happy to share it with you in the comment section. Please just ask for it. Cataract is obviously the largest cause of blindness in India, which constitutes about 63%. Then come uncorrected refractive errors. The word uncorrected is important because just a presence of refractive error does not mean the patient is blind. This refractive error can be corrected, with the aid of spectacles, with the aid of contact lenses, whatever. So an uncorrected refractive error is a cause of blindness. Glaucoma constitutes the next common 6%. Posterior segment diseases such as age-related macular degeneration or diabetic retinopathy. So diabetic retinopathy is on an increase simply because India very often has been called the diabetic capital of the world. So naturally, you're going to have an increased incidence of the complications as well. Corneal scarring, such as trachoma or keratitis, constitute about 1%. Childhood blindness and onchocerciasis are also very commonly seen in India. The numbers are not available. However, don't get too much into the numbers. Just understand that these are the common causes of blindness in our country. So how bad is blindness? Globally, 45 million people are blind, which means 45 million people have a vision less than 3/60 across the world, and 180 million people are impaired, which means they have a vision between 6/18 to 3/60. In India, 9 million, which means 1/5 of the entire world's global blindness exists in India, and that is expected because the population of India is also that large. It's about 1.21 billion according to the 2011 census. We'll have to see how the 2021 census turns out. Obviously, it has to be higher. So, what are the differences between a developing nation and a developed nation in terms of the causes of blindness? So, developing nation, say for example India, cataract is obviously again the number one cause. Infectious diseases such as keratitis, such as trachoma, so on and so forth. Childhood blindness such as xerophthalmia is also a common cause. Ocular traumas, either in the form of road traffic accidents or domestic injuries or accidental injuries. Glaucoma again comes, and onchocerciasis. Compare this to the developed nation. Cataract comes very low in the list. Primarily a rich man's disease would be ARMD, because if you have to live that much to develop ARMD. And glaucoma and diabetic retinopathy again are very common in developed nations. But understand that 90% of all the blindness in the world exists in developing countries. Developed nations constitute only 10% of the blindness. So in India, if you are disabled, which means if you're visually impaired or if you're blind, there are certain benefits that you can avail. So this is Disability Certification Protocol, and this comes under the Rights of Persons with Disabilities Act of 2016. So depending on how much blindness you have or how much visual impairment you have, you can claim certain benefits, which are either tax benefits or employment benefits. Say for example, your train tickets may cost a little lesser than a person without disabilities, or you may be allowed to have an accompanying person along with you at a subsidized cost, so on and so forth. So there are benefits that an individual can avail, And these benefits are based on the visual acuity as well as the visual field. So the actual table is pretty large. I'll share a link in the description if anyone's interested. But you need not know how we exactly do the disability certification. Just understand that a visual acuity and visual field both are important for the certification, and it is awarded as a percentage. For example, if I feel that this patient, based on the clinical examination, is having 40% disability, then I will award it a 40% disability certificate, and that patient can avail benefits according to that percentage. Couple of facts that I wanted to share with you. Cataract surgery rate. This is nothing but cataract surgeries per million population per year. So the current rate is 5,200 in India. The highest rate is in Gujarat, which is 13,000, and the lowest is in Sikkim, which is 339. How do you prevent blindness? So there are three levels of prevention. This is going back to the PSM discussion that I particularly find difficult to remember because I find it difficult to apply it clinically. But understand that this is how community medicine works. When you're studying, you're going to study about one case, you're going to study about one disease. But when you're treating, when you become a resident or when you graduate, you are going to have to deal with a lot of people at the same time. So this is where community medicine comes into play and actually comes handy to manage the situation. So there's a primary level prevention, secondary, and a tertiary level. Primary basically means you prevent the risk factors. For example, keep your face clean, you will not get trachoma. There are no risk factors. So the risk factor for trachoma is bad facial hygiene. Remove the facial hygiene part. Take care of the facial hygiene part, you will not get trachoma. So that's primary prevention. Secondary basically means early diagnosis and treatment, and a very often forgotten component, that is to prevent any complication onset. And tertiary means the next stage. If a complication happens, then manage the complication and provide rehabilitation to the patient. So in a case of blindness, you would consider low visual aids or disability certification. So that would come under a rehabilitation protocol. So cortical blindness, I just thought I should share this thing with you. It is not related to the discussion of community ophthalmology of blindness, but I thought it is interesting to note. So cortical blindness basically means that the human eye is normal, both eyes are normal, but there is a damage to the processing center in the brain, which is the occipital cortex. So when there is a damage to the cortex, everything is normal. You do fundoscopy, it doesn't seem like anything's wrong, but still the patient cannot see. So such a blindness where the cortex is at fault is called cortical blindness. And a very interesting phenomenon called Anton's syndrome occurs in cortical blindness. So Anton's syndrome, the patient is cortically blind, so bilateral cortical damage is present, but the patient denies blindness. He says he can see everything. He is going to, not malinger as such, he's going to just, provide, how shall I put it, incorrect responses. Suppose you show him a number 5, he's going to say number 12. He can say, I can see it very clearly, I can see it absolutely fine, and the number is incorrect. So that sort of a blindness is called Anton's syndrome. So the patient loses insight into his own disease. He's unaware that he has blindness, and this condition is also known as visual anosognosia. So anosognosia means he does not know that he does not know. So a little bit of a tongue twister. So that's Anton's syndrome. That takes care of the facts and figures of blindness. Please let me know if this lecture is useful, what other topics you would like me to cover. As always, thanks for watching, stay safe, and good night.